Welcome, everyone. I am here with Dr. Patrick Tyrance, one of my favorite orthopedic doctors, someone who I really admire for your ability to really look at our health from a completely 360 approach. Every time I've spoken to you, it's been about integrating what works, what's new and up and coming for our health, what we can do to really stay active and in the game, but using really new technologies and things. So I love your perspective on joint health. So welcome.
Thank you, Dr. Gupta, for having me. Appreciate it.
Thanks for coming. So let's dive in. I would love for you to start with your story because I think you have a very unique story as to when and how you got into medicine and your journey there.
Thank you. Well, basically, it's rooted very much in a strong family, family that focused on the importance of faith, health. I had a sports background. I played football from the age 7 to 22, 23 years old. Music, my mother's a pianist, and so oftentimes Saturday mornings would be battles between my mom and dad. Am I going to be taking piano lessons on Saturday versus playing football? In earlier years, it was a little bit of both. I played college football at the University of Nebraska, was fortunate enough to earn an athletic scholarship there, biology pre-med major.
Nice.
And my initial exposure to medicine was me experiencing my teammates and college roommates having football-related injuries. And several of them didn't fully recover. Many of them did after having surgery. So the first physicians that I was exposed to were orthopedic surgeons. Okay. And I love the idea of dealing with athletes, focusing on functionality, performance. And early on, I was a health science major, struggled quite a bit actually. Early on, and then really had to refocus and learn how to study, setting goals, delayed gratification.
Sure.
And had a great college experience. Played my last college football game in the Citrus Bowl, and then that following day, I started my medical school interviews. I was accepted to Harvard Medical School, delayed my acceptance, earned a, blanking on the word, I earned a deference, deferred my admission, and then was drafted by the Rams 3 weeks later. Wow. Had a young family. So at a young age, I was able to have some pretty incredible experiences. Was on the roster for a season, and then enrolled in medical school. And although my initial interest was orthopedic surgery, I tried to keep an open mind. Went through all my education rotations and said, yes, orthopedic surgery is truly what I wanted to do. But I have very much more of a integrated or holistic approach to what I practice. It is very much focused on function, movement, performance, and so I try to bring my athletic background, certainly my musical sensitivities, sensibilities,
sure,
faith. I have a lot of spiritual, a strong spiritual background that I try to bring to my practice as well.
Cool.
Whether it be covertly and not so much right up front.
Sure.
Yeah.
Sure. Well, thank you for sharing that. So you were playing football. You did get drafted by a pro football team, but still decided to go to med school.
Oh, CTE or concussions, chronic traumatic encephalopathy wasn't as big a deal then. It wasn't so recognized.
Sure.
But I did know that medicine is what I wanted to do.
Okay.
And frankly, during training camp, this is the first time when the Rams were in Los Angeles, and they were, we were frankly known as the Lambs and not the Rams, and not terribly successful during the season that I was there. But I remember one of the there's this Ferrari Testarossa in the parking lot, and none of the players had a vehicle like that. And I was like, my goodness, like, whose car is that?
Yeah.
I was like, oh, that's the team doctor's car. So I was like, okay, I see where this is going.
Yeah.
I see where this is going. I need to, finish up here.
As well.
Yeah, get to medical school, and I was a team orthopedic surgeon, and certainly healthcare has changed, but before I seriously considered professional sports, I mean, I loved playing college football and was fortunate enough to do relatively well. A pursuit in science or medicine was always there.
Okay.
So I was not necessarily willing to change that trajectory.
Sure. Cool. Such an interesting story. Like I've not met someone who has had that journey on the way to med school. So I'd love to dive into some of the things you do in your practice, some of the things that you're into. Every time we talk about regenerative medicine and what's happening there. And I know that you're always looking to bring new tools into your practice and utilize them on patients and see the results and be part of scientific studies. There's so much about academics in terms of what you're trying to do out there. So will you share a little bit about some of those things just to highlight for people? Like, I think people assume, I go to my orthopedic doc and he's going to give me a prescription, or he'll say surgery and that's it. And right. I think there's so much more in the spectrum that people just don't hear about. So they don't know that if they go, there are other perspectives that they'll get, especially coming from you.
Well, I mean, my orthopedic surgery training was several years, 6.5 years of residency, 5 years of medical school, and including a master's program. So 11 to 12 years of training after my undergraduate college year. So I am very much a surgeon, and I enjoy performing surgery, but the goal isn't necessarily, which I think at times my colleagues and at times myself, I've equally been at fault of treating imaging, treating x-rays, treating MRIs, and not seeing the entire patient. So I like to exhaust non-surgical management and utilize non-operative treatments, and as well as surgery, working with the patient towards a specific outcome. So more recently, I'm using fewer steroids, corticosteroids, and it's a relatively quick fix, if you will. It's still a tried and true and many times gold standard in injectables as far as treating arthritis. But we do know, along with the strong anti-inflammatory effects, it also has a negative effect on normal tissue.
Sure.
So repeated injections can be detrimental and have the opposite effect of what you're intending. So more recently, I am using more plant-based injectables,
awesome,
which are very safe. You can use multiple injections. It doesn't burn any bridges with respect to quality of the tissues, and if you wanted to perform surgery at a later date.
Nice.
So that's something that I really enjoy, and I've gotten good results from that.
Awesome.
Regenerative therapy with respect to PRP, I've been using that for probably close to 10 years now.
Wow.
And certainly the way I've used it, the indications, treatments have changed. Mm. So I do believe the ability to leverage the body's ability to heal itself as we're learning more.
Sure.
And gaining a better understanding of chronic disease, and being able to tap into more innovative, more creative, safer, more effective ways of addressing some of those challenges.
Sure. And I know one time we talked about, you were talking about corticosteroids, and we were talking about how there was a company that came out with a solution that was more plant-based and natural, and you were using it for a while, but it got bought out. So have you seen a lot in the marketplace where there are solutions that come up that are natural, but then they're quickly bought out or squashed, and you're constantly seeking newer solutions?
There's absolutely an economic component. There's a financial money component. I mean, it's not by mistake that companies are bought out and some products are no longer available to the general public, despite their efficacy, their effectiveness in treating illness. It's not by mistake that the healthcare market and industry is about 1/7 of our total economy. Maybe in the order of $8 to $12 trillion, or at this point, the numbers may be off, but it certainly is about 1/6 to 1/7 of the total economy.
Sure.
Again, so there is a financial driver. I think the challenge is, as providers, is to certainly maintain a level of passion and focus and intent despite some of those, despite the external environment.
Sure. Those
Health
outside
insurance,
forces.
exactly, that are kind of pulling and tugging. And so the environment has changed quite a bit.
Yeah.
I think patients are more educated. They're asking for alternatives. Physicians are feeling pressures that are causing them to question the influences on medicine. And so people are actively seeking alternatives
Sure.
to the present system.
Absolutely. And, I remember I visited you a couple months back probably, and I walked in that week and you said, I had like 6 patients come in, and out of like however many patients. And you said I recommended an injection to them because that's what I would recommend for the issue they had. And like 4 out of 6 said no. And I looked at you and I said, what are they coming to you for then? Like, there's a certain toolbox you have, and they're saying no to the toolkit, and they're coming to you. So how do you work with those patients and kind of educate them and say, look, these are the solutions I have. These are the opportunities you have. Yes, there's physical therapy and all these things, but out of the solutions I've got, this is the best one for you. Like, how do you work with them and give them those options?
I mean, number one, I do the best I can. As a surgeon, I have to build rapport relatively quickly.
Yeah.
I'm not a primary care physician. There's not a lot of repeat visits.
Sure.
And so initially build rapport, build trust, and that comes through listening, allowing them to tell their story, and me gaining a clear understanding of what their need is.
Sure.
Sometimes it's not necessarily
treatment
in the pain, or their initial complaint is not necessarily their true complaint. There's oftentimes something underlying. So if I even take a little bit of time to listen and as best I can, gather that information and repeat back to them, whether or not I'm understanding it correctly.
Sure.
And getting buy-in from the patient. So once I get buy-in and a level of understanding and connection, then oftentimes the recommendation that I make, there's trust there.
Sure.
And so it doesn't, if I make it about me, I say, well, you need surgery. I'm a surgeon, and I have 5 tools here, and a scalpel, a needle, a brace, and none of them are necessarily what the patient is looking for, then I've lost, they've lost.
Sure.
And so, even in increasing compliance, there has to be buy-in. And so with me playing team sports and understanding, which has been I think a big part of how I approach healthcare, because I see the patient as a teammate,
Right.
and having to find a common point of interest and a goal that perhaps different values, different backgrounds.
Sure.
But then we're trying to get to the same destination, and I'm absolutely not able to help them any more than they're willing to help themselves. So I need to get them on board, for their own care.
Sure.
I played linebacker in football, very aggressive position, quick decisions.
Sure.
And, and still very much a surgeon's mentality. So, with that, it's like, okay, let's come together and help me help you. But I can't run a sprint further along than where you're willing to go. I need you to, put on your Will Ferrell headband and, your take off your training wheels and let's go.
Right.
If you came to see me, if you want to do this, and let's go, let's make it happen. It doesn't always have to be surgery, but
sure.
We need to be on the same page with how we approach things.
That's really beautifully said, because a lot of times I think when we go to a doctor, we're looking for an answer. And nowadays, you're right, the patient is more educated. So even though they're seeking an answer, they're also judging if they're willing to take on that answer or do anything with it. And so for you to say, I align to their goals, I'm trying to align them to the goal of fixing their health, and then bring them on as my team player, that, hey, I'm on your team. I'm here to help you cross your finish line or the end zone, whichever analysis or analogy you want to use. It's so powerful because, like you said, compliance is key. I find even for myself, I go to physicians and doctors. I have the honor of meeting all the most epic doctors. And so when I have an issue, I can say, hey, let's talk about it. But I find it fascinating for myself who I'm compliant with and who I'm completely not compliant with. And I'm obsessed with health. So for me to have practitioners on board and I'm listening to one and not the rest, I kind of step back and analyze. I'm like, why am I listening to this one? Oh, she's taken the time. She has sat there. She's explained to me the good, the bad, and the ugly to not hydrating or not absorbing things in my cells or not taking action. And so I think that's so powerful, because without compliance, where are we going to get?
And patients are very observant. So I think as practitioners and providers, you have to be about it. Yeah. I've had many young and old, if you will, and they'll comment, well, I'm very active, whether it be soccer, pickleball, golf, and I have hip or knee pain, and the doc says, well, I can give you an injection and don't play golf. It's like, well, I get enjoyment out of being active.
Yeah.
And then also, if the provider isn't particularly active, they're going to make a recommendation oftentimes that is consistent with their value system.
Sure.
So it's important for me to practice what I preach, and not only just talk about it, but be about it. And I absolutely know and struggle at times with my own fitness, my own eating habits, just like the next person.
Sure.
And so, but I do feel more confident when I am actually heeding the advice that I give to patients. So sure. I think that means a lot. And patients have said they are more inclined to be compliant with the provider that actually is active and believes what they're saying, and oftentimes by actually doing it. And so, again, it's like leadership,
sure,
and mentoring,
totally,
to some degree.
You have to walk the walk.
Yeah.
I
exactly.
teach so often that I laugh when I go through seasons. Like, I'm in a season where I do tons of podcast interviews where I'm being interviewed. And so I'm teaching Ayurveda, I'm teaching inflammation, I'm teaching turmeric, I'm teaching gut health. I can't then go out and have wine and glutinous food. You know, like it feels so out of resonance to do the opposite of what you teach. And so, of course, when you're in this field, it makes sense that you would work out and be fit and be into the things, because that is your joint health. Right. That is your bone health, your preservation. When it comes to patients, I do find it fascinating where I have gone to physical therapy in the past, and I don't go to PT much anymore because the PT I used to go to always gave the same answer, which was stop the activity. Mm-hmm. Obviously, you know, if squat jumps have caused problems, you shouldn't do those anymore. Mm-hmm. Obviously, you can't lift overhead anymore. And I was like, I'm still about 40. I don't think you should take away lifting overhead from me yet. Right. I don't think we should take away jumping just because I tend towards plantar fasciitis. Like, I think instead the answer is build a really strong core, go and build all the muscle you need to do the different things. Mm-hmm. So how do you kind of enlist that patient in your patient database or your group who come in who are like, you know, I have all this pain, doc, and I've heard so many orthopedic surgeons who say, you just need to lose 30 pounds. Right. You just need to lose 40 pounds. That knee pain, I'm not even going to operate on you until you lose that weight. And I'm like, well, the person walked in, are you going to give them any guidance or support on this journey? Right. So how do you kind of work with people to say, look, I want you to want this. I know this is going to be hard, but I need you to get there or we're not going to win. Right. There's no like get out of jail free, one injection will magically make it happen.
Right. So I think initially it's important to gain an understanding of what their baseline level of activity is, what their expectations are for them, how do they define success, and then starting from that endpoint and working backwards.
Sure.
If it's a joint issue, I tell folks joints are happiest when they do what they're designed to do, and that is to move.
Sure.
So even if there may be some injury to the joint, the challenge for me is how do we allow that joint to move? How do I make recommendations that allow that joint to move and not cause further injury and facilitate healing? And also allow that patient to understand that, you know, perhaps they're not as sick or injured as they would like to think.
Sure.
And the whole idea of actually gaining some movement. Also looking at the entire picture, you know, whether it be support from family, spouse, their diet. Oftentimes we'll make dietary recommendations, supplement recommendations. Sure. With respect to pain. Pain oftentimes is due to, you know, inflammation.
Right.
And so, you know, even that mechanism, you know, anti-aging, which I don't particularly care for that term.
Yeah.
I like to use the term youthful aging and doing things that can break that chronic inflammatory free radical formation, oxidative stress cycle.
Sure.
And when you look at the whole person, someone comes in with knee pain, for example, say, well, a lot of your issues can be addressed by, as you mentioned before, a strong core.
Sure.
Hip mobility, muscle flexibility exercises, foot and ankle exercises to help there. So I think looking at not just a particular joint, but also perhaps a joint above, joint below,
sure.
and functionality, and then addressing the primary issue, but also giving additional recommendations that may keep them active longer and hopefully keep them out of my office with preventive measures.
Sure.
So in that respect, taking a bit more of a holistic approach.
Totally. I have a funny question because I know we've talked about this briefly in your office, but pickleball is an up-and-coming sport. People are so into pickleball, and all I hear from all the orthopedic surgeons who carry my supplement and the PT offices is, man, pickleball is good for business. And I'm like, really? They're like, you have no idea. And I've seen friends of mine where they went on the court and like within the first 20 minutes tore their Achilles, got healed it, boot, everything, then did it again the next time on the other foot. So to me, when I see something like that, I just stay far away because I have no patience for injury. Like, I never want to be out of the gym. I never want to be out of the game. I do want to, though, push like whatever boundaries I can to be out there and mobile and all, but not if it's that high risk. So what are your thoughts on pickleball and what are you seeing?
Yes. So just as you described, a lot of the injuries related to pickleball or racket sports, Achilles tendon injuries, tennis, elbow, lateral epicondylitis, inflammation, shoulder injuries. But I think the common denominator is overuse.
Sure.
And whether it be young or old, and many of my patients have tended to be 40s and above.
Okay.
And it's not the occasional pickleball player.
Sure.
It is someone that is really taken to the sport.
Okay.
And they'll play 3 to 5 games a day, 4 to 6 days a week. So what the piece that they're missing is that they're not allowing the body a chance to rest and recover.
Sure.
So even doing something that's good, positive, fun, there's cycles to everything.
Sure.
So there's a time to be active. There's a time to rest.
Yeah,
There's
course.
a time to build, a time to break down. And so a lot of it is overuse, and I think it very much can be prevented. So I kind of give them programs and give them general principles that, again, allow them to be active, but in a smarter way and in a way that promotes longevity and being able to enjoy the sport for a longer period of time without injury.
Sure. And let's talk about that. I think so many times when people exercise or do anything, they get really into it. So, for example, I go to a gym here in Boca. We do HIIT training there. We lift. We do cardio workouts. I love it. I feel so amazing when I leave the gym. And in any given time, I can focus on strength more or cardio, whatever. And the other day, I was going into the gym. I work out Monday, Wednesday, Friday because those are the days that work for my schedule. They have earlier classes. I can get to work on time. But I noticed the other day, because I was running in to do light cardio on the other days, 'cause my schedule's been off. There are people who work out there 6 days a week. Mm-hmm. And I was like, what's wrong with you guys? Mm-hmm. I know this place is awesome and I know it's fun, but where's the recovery in here?
Right.
Like, how much wear and tear can you put on the body? So kind of when people are into their sport and they get a high from it, like I feel so energized on my workout days. How do you speak to them about, like, look, there's a balance, maybe active recovery? Sometimes I just walk for 20 minutes. I'm like, this is my active recovery day. So I'll keep it that light. But it takes discipline to not work out.
Right.
It takes discipline to not be intense for some people. So is that what you're speaking into when it's like the pickleball? They're so into it that it's like a 6-day-a-week thing now?
That is what I'm speaking of. And so there is a level of harmony, or I don't even want to say balance, because when we talk about balance, we think about things being even.
Sure.
And it doesn't necessarily have to be even. There's a time and a place for everything. So even with professional athletes, when you work out for an upcoming season, there's a level of 2 practices a day. You're putting in a lot of time physically. You're building muscles and your cardiovascular fitness, et cetera. During the season, because of games, et cetera, you're not practicing or you're not working out the same way.
Sure.
Much of what you're doing is mental, looking at film and et cetera. At the end of a season, when you're physically beat up and you perhaps over time have not had the chance to fully recover, at the end of the season, you're using that time to address injuries, do other things that allow you to stay active. So there's this when I talk about cycles and periodicity, which is meaning that there are certain periods. And so the culture is very much, let's go, grind. People, it's popular and you kind of beat your chest, well, no one's going to outwork me. And let's go. You know, it was so like, true. Let's go. LESSGOOO. Let's go. Grind. You know, well, I mean, we're not cars, but you run a drag race. It's like those sprints are pretty short.
Sure.
You burn out the tires. You know, you go and you change the fuel and the filters, and people don't run drag races for miles. They're pretty short. So, your body, perhaps not the best analogy.
It's true, though.
You can't go at such a high level. So, and I've learned from experience, and I used to do high intensity interval training about 4 days a week. I would have 2 early morning workouts, a couple of workouts on Saturday, injured myself. And I understand now, and I get a lot of satisfaction and perform better by incorporating more yin, if you will, activities. I do yoga, mix in some Pilates, but I love Qigong.
Wow.
And being able to work on mobility, flexibility, this whole idea of effortless flow, decreasing resistance, and giving my body a chance to recover.
Yeah.
Focusing on the mental aspect. Patients come to me and because oftentimes we sit for long periods of time in either working from home or a sedentary lifestyle, and hours on end. I said, work for 45 minutes, 50 minutes, and set your alarm and take 10 minutes, do a little walk, some breathing exercises, some stretching, and you'll find that you'll actually be more productive.
It makes sense.
And that is, and again, it's not a balance piece,
right?
Where I'm saying, okay, go walk and stretch and get up for 30 minutes and then work for 30 minutes, but given your brain and your body a chance to offset what you're doing provides a level of harmony and polarity, if you will. So that's where the whole idea of being productive and providing longevity and being able to enjoy what you do. So back to pickleball, you don't play 4 or 5 games a day, 6 days a week.
Right.
Go swim, go bike.
Sure.
Do Pilates, and I say yoga.
Totally. They're wonderful.
And you're still working on muscle groups that are, you'll find that your game of pickleball or whatever it is that you enjoy doing, you'll actually perform better.
Sure, because you're going to lengthen those muscles, you're going to stretch, you're going to recover, you'll build small muscle groups, different muscle groups. You're right. There's such a different approach. I think societally, we are in such a grind that we constantly see everyone around us doing things. I know for me, I'm like, well, I can do it all. I know I can. I'm perfectly capable. I'm smart and I have energy and I have everything going for me. So I will write a book and do 100 podcast interviews a year and X, Y, Z, A, B. And, we want 1,000 doctors carrying Fusionary, and it's just, the list goes on.
Right.
But then physically, if you're not going to manage yourself with self-care, with seasonality, like you said, cycles, if you're not going to go full throttle and then take your foot off that pedal, I always give the analogy of treat your body like a Maserati. And if you were a Maserati, you wouldn't go like hundreds of thousands of miles without giving yourself an oil change. You wouldn't stop to fuel. You would have to treat the car nicely if you were going to maintain it beautifully. And so kind of like what you're speaking to, it's like if you're going to go full throttle and never allow the body to recover, of course you're going to end up at your door with a problem.
Right.
Yeah.
And unless you're willing to make that shift in your mindset, then you're going to continue to get the same result. And you're certainly going to limit what I can do to help you, help yourself.
Sure. That's so true. So when it comes to some patient stories, do you have some interesting patient stories you can think of where, your guidance or your tools have been able to really help the person kind of come out of a bad spot, or maybe they had gone somewhere and gotten an opinion and they didn't want the surgery or something, and they came to you and you were able to kind of redirect the course of their lives and their injury experience with what you do?
I mean, there's not one specific story that comes to mind, but I think, if not daily, almost weekly, I have experiences where patients will share a level of frustration, and I am finding that fewer patients, want to have surgery.
Sure.
And they're looking for non-surgical alternatives. And so they're pleasantly surprised when they see me, and I'm able to offer thoughts and opinions with respect to supplements that have anti-inflammatory properties. I'm a big believer in high-dose vitamin D. I believe vitamin D3 with K2 and optimal dosing of that. Vitamin D is more of a pro-hormone and not a true vitamin. So there's a lot of anti-inflammatory, immune effects, antidepressive effects associated with that. And athletes can, and your everyday person can benefit from that. So even making a recommendation like that, regenerative therapies, turmeric, I'm a big fan of turmeric as an anti-inflammatory.
Yeah.
And so these are things that they appreciate, and then say, look, we can always do surgery, but at the same time, it allows them to have some level of ownership. And so I think one theme that I try to do is empower the patient and say, look, okay, you're coming to me for information, but you really have the tools.
Sure.
People think I have the tools, but you do. And so it's up to me to help you identify those tools. It would be your mindset, your lifestyle, the language that you use. And so they're not always coming to me looking for answers.
Sure.
But they're tapping into their own power and level of accountability. Yeah. So I think that is a difference maker.
Awesome.
And so, the sports related things that we spoke about. I've had individuals come in that shoulder injuries, and I said, look, I'll use a regenerative therapy, and they'll give them exercises on core strengthening and hip mobility. Sure. So much of your strength and much of your velocity and the mechanics of your throwing is through your core and your leg strength.
Sure.
Hip mobility. All of your control and velocity is not through the shoulder and through the arm.
Of course.
So if it is now, it's a bad habit, and you're not going to last very long.
Right.
So even doing things like that helps.
And you're coming from that sports background, so you can highlight that for them.
So they seem to appreciate that.
Nice. Well, you mentioned turmeric, which is my favorite topic on earth. Yes. So will you share a little bit about your experience with inflammation relief or turmeric for your patients and what you've seen?
I do use Fusionary formulas, and even before we met, I used turmeric for myself. I will say that part of what I bring to my practice as well is I completed a health coaching certification through Institute for Integrative Nutrition, and bring some of that knowledge to my practice. So I love the idea of curcumin and some of the technology around that, black pepper to increase the absorption, as a safe alternative to over-the-counter or prescription strength anti-inflammatory medication. More patients, it's interesting, over the last, I'd say, 5 to 7 years, 7 years ago, people were like, what is turmeric? What is curcumin? I mention it, people are like, oh, I know, I already take it. So I'm finding more of that, and patients are actually educated on that. I like it because with respect to gut inflammation, gastritis, as an anti-cancer agent, is safer on the gut, and it is equally effective as an anti-inflammatory. And then combined with things like ginger, boswellia, berberine, echinacea, a lot of the botanicals, definitely has a benefit. And I do believe food is medicine, and it's a place to start, and can empower the patient to certainly take ownership. And it also affects different treatments and how effective I can be in addressing their issues.
Awesome. I didn't know you studied health coaching.
I did. And there's a whole
it's
story
so
around
fascinating.
that.
My brain's like blowing up on the inside.
Yeah,
that's cool. It's like an openness to all the different ways that we can use food and herbs and supplements and all these things, botanicals in our body. It's so different. Yeah. I've never met an orthopedic surgeon who said, yeah, and I studied health coaching to understand all these different approaches.
The way I approached that, or what turned me in that direction, I had a very busy orthopedic practice, hospital-based, and felt like I was on this hamster wheel, performing 18 to 25 surgeries a week. And frankly, my own health wasn't the best. My father was sick and had cancer, multiple myeloma, and subsequently passed from multiple myeloma. So I was in not the healthiest place mentally, and felt a level of frustration, burnout. I said, how can I do things differently? And in fact, left medicine for almost a full year, 10 months, and studied nutrition, finished up an MBA, and said, if I go back into medicine as a practitioner, as a surgeon, I have to do it in a way that, for me, is sustainable, more consistent with my values and goals, and frankly, not be more, practice in a way that was more authentic and true to myself.
Sure.
And so that's been a challenge, but at the same time, there's been a greater level of satisfaction in doing that.
Nice. It's interesting. I have the luxury of meeting thousands of doctors. I built Fusionary, my supplement company, 7 years ago. And so as I meet doctors, it's interesting. And I have children, so I'm always like, do not go into medicine. Right. The one thing you should not do is go into that profession. But it's because of what you're speaking into, which is so many practitioners sign up to be incredible healers. Every doctor I meet is brilliant and intelligent and giving and caring and wants the best for their patient. And yet sometimes you get signed up for a way of practicing that looks like it's going to be great. And it turns out to be you're a cog in a machine.
Right.
And you lose the ability to oftentimes practice the way you want to. And so I've seen new models emerge. I've seen practitioners go and open concierge practices where you can take a lot more time to kind of unfold with what the patient needs and has going on. Or DPC, direct primary care. I've had a few DPC doctors on this podcast because I meet them and I'm like, wow, what a cool approach. Functional medicine. I love functional medicine. And as someone who's into integrative health, I love all the complementary alternative modalities that exist: Ayurveda, homeopathy, naturopathy, chiropractic, all of them. But it's just interesting to me where, as a practitioner, you said, you know what? This isn't working for me. I don't want to practice this way. This is not sustainable. This is not going to, I don't have longevity doing it this way.
Right.
So I'm going to take a minute, go get healthy again, figure out my way of being healthy and whole, because you were an athlete. You were someone who was always the healthiest, stepped into medicine, got kind of dysregulated, and then had to come back into wholeness to build the practice you have now. Because I've seen your practice. You spend time with your patients. You dive into the issues. So I think it's really cool that you did that.
Thank you.
Yeah.
Thank you. I appreciate that.
So in terms of your practice, is there anything else you want to share in terms of your approach, what you've seen, orthobiologics do for your patients, or anything else up and coming that's of interest to you that you plan to bring in? I know you're always trying different tools out there and bringing them into the practice.
I mean, thank you for the opportunity. It really is, my goal is really to develop a holistic orthopedic practice open to other modalities and adjunctive therapies, and not seeing the patient just as a joint or a muscle pull or a chief complaint. And it really is about empowering the patient to take ownership of their health and implementing and tapping into the body's ability to heal itself. I love regenerative medicine. I think between that and some other technologies with respect to longevity and studies related to telomeres and things that really address that mechanism of chronic inflammation will help with respect to youthful aging.
Sure.
And having a more vibrant lifestyle. I think as patients and the general population become more educated and ask questions, it will really force physicians to and force the healthcare system to be more responsive and to be more patient centric. I think physicians have to be ready and more flexible in that. I'm very fortunate because I'm a solo practitioner,
right.
But I'm also understanding and finding that there's more and more physicians, as you mentioned, that are interested in this. And I've had a number of inquiries and the ability to scale. So my practice really is, I'm at the time now where I'm implementing more operations and systems, if you will,
Sure.
that are going to allow me to scale and not be so much a technician and working in the practice, but spending as much time on the practice and being able to affect change in a much broader way.
Nice. That's awesome. You spoke into chronic inflammation and its impact on longevity and telomeres. And for me, that's always a fascinating conversation because I love really explaining to people that inflammation is that root cause. It's that slow burning fire. I always try to come up with so many different analogies. Lately, I was like, you know what? It's like putting the wrong gas in your car. Like imagine if you were a diesel car and you put regular gasoline in there. That would cause some problems. The whole system's going to melt down from the inside. So I'm always trying to think through, like, how do you explain to people that, look, this is the foundation. We have to address this. Otherwise, when you have a joint pain, that is just one red alarm going off. There's going to be a lot more after it.
Right.
The underlying root cause must be addressed. Right. So how do you kind of think about it and how do you approach it in your own life? Because there's you with the practitioner hat on. Obviously, when you see patients, it's like, okay, let's talk about it. But I find oftentimes as the practitioners, we have like a whole different perspective. Like for me, I look at inflammation as simple as we aren't using as much plastic in our homes. I don't want my food stored in plastic. I don't want us drinking out of plastic. That's one aspect. Another is EMF. Is there Wi-Fi and printers on, near all the bedrooms of ourselves and the children? Mm-hmm. Like it can go as wide as that, and then it can stay as narrow as what are you eating that's inflammatory, right. And what is your stress level like, and how is that causing it?
Right.
So will you share a little on that topic and your perspective?
I think it's important to distinguish between acute or recent short-term inflammation and chronic long-standing inflammation.
Sure.
They're very different processes, and they're very what sustains them is very different. So acute inflammation is absolutely necessary and is a normal physiologic response to injury and is necessary for healing.
Correct.
And many of the drivers of acute inflammation are immune cells proteins, growth factors that increase blood flow to an injured area, remove cellular debris, remove injured tissue, and provide nutrients. And so, you have swelling, redness, pain. That's necessary. So that usually lasts anywhere from 4 to 6 weeks. It's very different than a chronic, long-standing inflammation, which can have a number of drivers, whether intrinsic to the patient, cellular debris, their foods that they eat, hormone imbalances, environmental causes. So as much as we can, addressing those chronic inflammatory mediators is necessary, and it helps to break that pain cycle. So a lot of the things that I recommend is breaking that chronic inflammatory cycle,
Sure.
removing the cellular debris, if you will, and then trying to heal the tissues, whether by food, injectables, motion, activity, mindfulness, cortisol levels. We talked about grind, go,
Yeah.
and the adrenaline and cortisol levels, which if you experience that chronically,
Yeah.
are very detrimental. And so even something as simple as breathing exercises and conscious breathing helps to stimulate that parasympathetic response and decrease cortisol levels. I use that a lot before my injections. People are like, oh my God, I hate injections, I hate needles. And
Yeah.
so there's little things like that I think help,
Right.
and it empowers the patient, and they don't necessarily have to go out and buy something. It's like, take a deep breath,
Exactly.
chill,
Totally.
smile, have a pleasant thought.
It's true. It can be that simple. Yeah.
Turn your frown upside down. I mean,
So true, though. I mean, we
stop
do.
the foolishness.
It's true. We do forget. We forget to even take deep breaths, right? It's funny, but you're right. It's people in that fight or flight mode all the time.
All the time.
Yeah. I laugh at myself when I do it. I'm like, okay, really? You're going to lock into that mode for the whole day?
Right.
Could you choose better?
Right.
Okay, fine. And it's funny because Ayurveda sister science is yoga, and part of yoga is pranayam, which is deep breathing techniques.
Mm-hmm.
And so if we just started our day with that and ended our day with that, how powerfully different would our life be?
Very different.
Yeah.
Very different.
Exactly. So what are your, I feel like I could talk to you all day, but to wrap up, what are some of your things that you do for your health that are your non-negotiables? For me, it's walking in nature.
Mm-hmm.
Tea time is me time. I have a certain addiction to tea.
Mm-hmm.
So what are some of your things that are so important to you on this journey? Because you said, I have to walk the walk to do what I do.
Early morning workouts. And so my morning time is very important. I usually get up anywhere from 4:30 to 5:30, and it will include either high intensity workout, qigong, journaling, juicing,
Nice.
and intermittent fasting. So I've rediscovered that, if you will, and usually eat between a 8-hour window,
Nice.
10 to 6. So I'm not constantly exposing my body to calories, good or bad, and really giving it a chance to rest. I mean, being able to digest food is a high energy
Activity.
So even just giving my body a chance to rest in that way. So those things are vital to me. And then at the end of the day, being able to take time out and think about what just happened during the day and assess that. And then quality relationships. I don't have a lot. I mean, I know a lot of people, but I think the relationships that I do have are high quality, and I try to bring value to them, and they bring value to me and challenge me. So for me, those are the non-negotiable things.
Awesome.
It allows me to bring my best self to patients and friends and family.
Awesome. Beautiful. I feel like every time I hang out with you, I learn so much. Dr. Patrick Tyrance, your practice is located off of Linton and Jog?
Correct. Just east of Jog. It's in Delray,
Yep.
Adjacent to American Heritage High School.
Awesome.
And come through.
Perfect. What's your website?
TyranceOrthopedics.com.
Awesome. So if anyone wants to find you, that's where they can find you. And you're also on social media, right?
A little bit.
Okay.
Tiny bit.
I know it's hard to keep all the balls in the
Yes.
air.
Yes.
I tell people follow me on Instagram and everywhere else. I don't know if I have time to maintain those other things.
Right.
But yes, perfect. Well, Tyrance Orthopedics is a good place to find you. Thank you so much for coming onto the podcast today. I really enjoyed having this conversation.
Thank you for having me. Always good to see you.
Thank you. Good to see you too. Thanks for joining me for this episode. Check out our sponsor, Fusionary Formulas, the potent turmeric supplement used by doctors around the U.S. for patients with pain and inflammation. www.fusionaryformulas.com. I'm your host, Dr. Shivani Gupta. For more, visit shivanigupta.com. Subscribe to this podcast in Spotify or Apple Podcasts. Click the follow button or subscribe in any of the apps that you use. That's all I've got for you on the Fusionary Health Podcast this week. You have the power to transform your health and achieve vibrant health starting today.